never know what could be coming through the doors, and this evening every bed in this emergency department is taken as staff deal with the sick and injured.
Your toes are nice and pink again, looks better. Just getting the plaster on now. The challenge is really about trying to get patients in, get them seen, get them assessed, get treatment started, and then hopefully get them either discharged or moved to a bed in the hospital ward. This job gets harder every year. The challenges get more and more every year.
The waiting time clock starts from the minute the patient arrives. The Scottish Government's target is that 95% of people should be treated, admitted or discharged within 4 hours.
I'm not in pain unless I try and do something. Obviously you have to wait for things to happen. I had to go to X-ray and then I had to go for a CT scan, and that all takes time, but basically it's been reasonable. Can't complain.
The emergency department here deals with on average 198 people every day, and maintaining a flow of patients through the hospital is a daily challenge.
It's probably a subcapital fracture there. Are we getting better? No, I'm afraid we're not. I think all the figures would show that our performance is declining over years. And again, not due to any lack of effort from ourselves in A&E. I would describe it as firefighting. We're constantly trying to deal with the challenge of the growing number of patients that come, and I think it absolutely affects patient care and also affects the staff as well.
On medical and surgical wards, staff say they continually look at ways to make improvements.
A question was asked, why are lots of patients coming in at, for example, at 6 or 7 o'clock? And that's due to the various things about ambulance pressures, GP pressures when patients present. So one suggestion was that we have an extra staff member on to see the number of patients coming at that hour.
There's always going to be a point where you feel overwhelmed, but I think with my experience in nursing, you get through it. We're as part of the receiving unit, so they always are aware of what our capacity is, what their capacity is. We also run a hot clinic, which is a clinic that GPs can send patients to.
In recent years, there has been a shift away from hospitals to delivering more patient-centred care and services in the community.
You ready?
Help yourself.
A new GP contract will see primary care hubs established, with the family doctor at the head of a multidisciplinary team.
Uniquely in general practice at the moment, compared to other medical specialties, we're seeing a slow decrease in the number of doctors. If we are serious about primary care, so general practice, district nursing services being part of our NHS, then we need to value them. And the amount of money spent on those services has fallen drastically in the last 10 years.
The complex health needs of our ageing population is something community nurses deal with during every shift. Patients like 80-year-old Margaret Mackey and her husband in Dunblane rely on this help.
I think it is better if you can't stay in your own house. I wouldn't like to be hospitalised all the time or go into a home.
The hospitals have their way of doing things, and that's absolutely what's needed there, but it's a different approach in the community, and that's what I love. I don't feel overwhelmed by it, but I know that there are times where it is difficult and it can be frustrating. I can't be there 24/7, and no one really can, and that's the hardest bit, where people are trying to live in their homes but they're gradually losing their independence.
The foot comfortable underneath?
It means a great deal to Margaret and I. Out of hours, of course, is a bit of a problem because you're dependent on NHS 24. You can have a long time on the telephone with them.
And have you taken anything for the pain?
NHS 24 was set up 15 years ago, and it handles 28,000 calls in an average week. For many people, it's their first point of contact with the health service.
Our processes, our staff, every single person that comes in the door focuses on delivering safe, effective patient care. We get a full range of symptom presentations, and some people will be very sick, and we provide them with the next step in their pathway, and that means that some lives will have been saved.
With pressures on mental health, primary care and community services, figures show many still feel the only option is to go to A&E.
Are we winning? No, I don't think we are. I think that's an ongoing battle that we're continually fighting. I'm a very strong advocate for doing our very best for patients, particularly the ones that are maybe elderly and are frail. But we need to decide as a society how we're going to best manage that health service need.
Sharon Frew, STV News.